Welcome to Women of the Wise Path, a place for fostering open discussions about womanhood in our new world paradigm. We are a collective of holistic practitioners, coaches, and leaders devoted to supporting women as we navigate the shifting landscape of our times. Through conversations on health, culture, spirituality, motherhood, partnership, business, and transformation, we intend to spark connections, bridge generations, and share wisdom about what it means to support women of today. Welcome to Women of the Wise Path. Hello, everyone, and thank you for joining me in a discussion with Sarah Lascano about the importance of being as the foundation of health. And being, it's a natural and powerful state of the mind-body alignment. As you all know by now, our understanding of life, of reality itself has shifted to another level. From a limited mindset based on duality, we move to oneness, or at least we are trying to move to oneness. And as 𝗪𝗓𝗪𝗏 beautifully stated, the biggest disease on earth is the belief in separation. So let's rethink with Sarah Lascano what we take for granted with the concept of health and open our mind to what, and I'm quoting her, an imbalance in the state of being is causing our health issues. So welcome, Sarah.
Thank you so much. It's a pleasure to be here with you today.
Wonderful. So just a brief description, because your bio will be in below the episode so people can see more. But just to introduce you briefly, you are an internationally recognized mind-body expert, master energy medicine practitioner, and I may add now quantum biofield therapy and medical intuitive. And so you merge your medical experience with healing modalities to help people recover their health when nothing else is working. And you founded the 𝗪𝗏𝗏 Energy Institute. So far, I'm right?
Correct. Yes.
I'm just kidding. I'm just kidding. Good, good. So it's interesting because I've known you for a while now. But reading again your bio made me pay more attention to that sentence. It struck me. To help people, it's very simple, but this time I cut it. To help people recover their health when nothing else is working. And it's like for me, so many people wait for the last minute really to take care of their health, or they turn, and this is true, they turn to holistic approaches as a last resort. So we've been living in a dualistic kind of mindset for so long, so we disconnected with our true nature and inner power. So you, as a holistic practitioner, what's your thoughts on this?
You know, there's never a time to put never a bad time to put our health first. Right?
Yeah.
It's one of the treasures that we have. It's something that, as you said, we don't appreciate it till it's not there often.
Exactly.
And so it's a wonderful way to honor your body by taking care of it. And when we place it first, when we put it at the beginning of our focus, the beginning of our day, the beginning of our plan, magic can really happen. And you know, as an aside, it's really my passion to integrate all that we have available to us. So the mere act of judging is an act of almost rejection, right? Judgment is, in a way, a rejection of energy. And if we can just not judge things as good or bad, that duality, we can just, what makes sense for me in this moment? Is it holistic? Is it integrative? Is it lifestyle? Is Is it simple? Is it complex? If we can just be present and in the present moment at one with ourselves, I think we can get some really good guidance on what will best serve us.
Yeah. Oh, I hear the resonance of Zen behind that. That's wonderful. I really love it. Yeah, yeah. And this is actually part of your concept of being. We're going to go into that. But the maintenance, I think people are still struggling with maintenance of your health rather than taking care of a problem that shows up. And my question, well, it's not so much a question than an observation, is why don't people do this? Because we all hear, yes, I know about that. Yes, I know about that. I took a master class. I took a class, or I watch a summit on something. So it's like people say very often, I know, I know, I know. So why don't you do it? So I was thinking, and because we talked about that last time, we can't blame people because we are stuck in a system that is still old-fashioned. But there are a few things that are preventing people from really thinking and doing the maintenance of their body. What comes to your mind, for example?
Well, the first thing that comes to my mind is energetic blockage because we all have programming that we are unworthy of investing our time or putting ourselves first or taking the time that we need for our own self-care. Or we might have beliefs that if we invest that time in ourselves, we need to feel guilty about it. We're taking something from someone else, right? Like a lack mindset. So we have these energy blocks that keep us from being able to take care of ourselves and actually carry through, even on our intentions. Like we might have the intention to do something and we get blocked by some of these past patterns, some of these imprints, and some of them weren't even ours. Some of them might have belonged to our family members. We might have seen them live these patterns, and they can be very strong, but unfortunately, they set the stage for illness. They truly set the stage for unwellness later on.
Yeah, I see. Yeah. And that also made me think of any new concept, even in science, like quantum physics, for example, quantum healing, or any new concept takes time to really settle in society and become something natural, expected. And yeah, so I really encourage, and that's what the podcast is about, with people who have a great experience and wisdom like you, is to show people, please take time to revisit what you think you know and try to really actualize, embody it, become that teaching, and not switch like a butterfly, try different things and stop because you don't see result. That's another thing, though. I'm sure you have experienced that. People want results, visible, tangible result. And so even if they know the body energy or biofield, it stays as a theoretical thing, and they don't give themselves enough time to really let it sit in their body, in that sense. Yeah.
Yeah, I almost look at that as another form of sabotage, right, Vivian? I mean, if
Ah,
when we know something, but we're not ready to live it, when there's something blocking us, we actually can feel fear rise that maybe we're making a wrong choice, and it can divert us away from the very things that can be beneficial.
that's very interesting. I
Hmm.
never thought of that. That's very interesting. Oh, wow. Because that also brings the issue, it's not an issue, but the idea of self-confidence and trusting your intuition, listening to your body, as you said many times. So,
Yes.
that's for me the interesting paradox. Because even if the medical field or the science, the traditional science, the traditional medicine does not believe in that, the wholeness of the body, they still are moving from duality to oneness. Why I'm saying that is because I am in my 60s, but my father was a doctor, and I do remember the era where we had many vaccines, in the 60s or whatever. So up to now, it's like a shift. We moved from infectious disease to degenerative disease in medicine. The focus. So it's not outside attacking us anymore. It's the inside degeneration. And then we move to autoimmune disease, like your body is attacking itself. And then we move to diets, and microbiome is important. And then to epigenetics, meaning you are in control and you can change. So it's like even science is doing it without realizing it. They move from outside enemy to yourself, the way you think. So it's kind of funny. So let's go straight into being, what you said at the beginning.
So in energy, if we look at the energy of our physical body, an awful large portion of the influence is from our conscious mind. Okay. Our conscious mind is spinning in thought. Most of us are spinning in thought most of the time. And those thoughts actually create emotional energy. Most people don't realize that, but thoughts are creators. They create emotional energy. So if I think the thought, oh my gosh, I don't know how I'm going to get all my work done today, that thought will then spur some anxiety or worry about how I'm going to get everything done today. Okay. And so our thoughts actually create energy, and it often is negative. I mean, there have been studies that show that the average person has between 70 and 90,000 thoughts a day, and 90% of them are negative. And actually, 80 to 90% of them are the same as the day before. That's a whole nother topic, but so our mind is super, super busy generating all kinds of negativity. And when we are thinking, we're typically not present, right? We're not being. We're either thinking about the future or we're thinking about the past. We're typically not thinking about the present. So now, if we also look at that conscious mind, it has a direct impact on our nervous system. And so all of these thoughts can really, and that resulting emotion can get our nervous system completely out of whack. It gets us into fight or flight, activates our adrenals, creates stress in our bodies, further pulling us from the present moment and starting a whole host of problems in our body. So being, I believe, is an absolute cornerstone of health, partially because it shuts down our brain, which is spewing negativity. So it's a great way to quiet things down.
You see. Yeah, absolutely. Yeah. And that brings us to the question of, you mentioned last time, the health system is broken and it does not support that view. It's still holding on the old paradigm. And and that's for me also the paradox, because science, medicine has proven, for example, that neurons, when I did my studies in biology, undergrad, neurons are only in the brain. Now they tell us it's in the heart too, in a section of the heart. Then in also in the intestine. Then where else? In that sense. And meditation now is recognized also in the medical field, a specific type of meditation, whatever, but they open, they understand now. The biofield energy, some people call it the chi or whatever the concept. But so despite all of that, how come the medical field does not open, And you explained to me, the system is broken. Can you give us some examples? Oh, we all touch that, but yeah.
Yeah. So we have come from a really, I shouldn't say that. There are many examples of practitioners, of doctors who are not open to mind-body influences on health. Let's call it that. However, there are growing camps, if you will, the integrative community, the functional medicine
Okay.
community, naturopathic doctors are starting to really acknowledge this mind-body link. And actually, the research is proving it. As you said, there's a lot of research, a pretty big body of research on MBSR meditation, on transcendental meditation,
Mm.
and showing direct correlation with improved health outcomes. So there are some small groups that are really starting to integrate this into care in the medical establishment. I was just at a conference in Philadelphia, Pennsylvania, at Jefferson Hospital System, whatever the proper name for that is, actually has a huge integrative health community at their School of Medicine. And they are integrating mind-body healing techniques into health care treatment plans, which is wonderful. This is what we need. So while the system really is broken, a lot of the system, it's absolutely true, it is, there are some growing bright spots and changes happening. So I think we're really at a crossroads where if patients know about how to help themselves, they can start introducing this and start talking about it with their doctors, and maybe we're going to get some more traction. I know in my news feed, I do see that meditation is like there's more and more research hitting the news about the impact of mind-body practices. So I think we have an opportunity to change things, but absolutely, if you go to your standard medical emergency room, your standard doctor, they're going to poo-poo and say, well, that's not going to matter. That's just whatever. You can do what you want, but that's not really going to impact your health outcome. But that's really not what the research shows.
No, exact, yeah. And also the fact that, well, it's beautiful to see the medical and the holistic joining, in certain medical centers. It's beautiful.
It is.
But also, I think, is the fact that in the training of medical school, they don't approach that. So doctors are also left with some blanks when it comes to diet, lifestyle, the basic things of life, you
Yes,
know?
it's true. It's
So
true.
that's
And, I really hope to change at least the mind-body component. I really hope to have an impact by supplying tools and knowledge that doctors can use in their practices. And so this is something that is really opening up, now. I mean, I really hope to be a leader in this change of our system because it's
wonderful.
not working. If you look at the numbers, we spend here in the US at least, we spend so much money on healthcare and we have pretty poor outcomes compared to how much money we spend.
Yes. Oh, not just the US. Absolutely. Oh, yes, yes, absolutely. And there's so much paradoxes in the way things are managed. But yeah, so as I say, we live in a transition, and many people are kind of, when are we coming out of that transition? Yeah. Another thing that's very in fashion now, I'm making fun of it, but it's not funny. And people accuse the COVID, but it has nothing to do with COVID. It was even before COVID. It's mental health. So that's a big umbrella. And mental health now has become like this new flag of we need to take care of our mental health, whatever that means. But the most important, it's about stress, as we discussed last time, stress. So there's the common stress, they call it kind of common stress, the regular stress that every day, and the clinical stress. That's something different. And but people live on, even myself sometimes, when I catch myself, I have to, whoa, step back, because we
Yeah.
all live on a survival or on a survival mode, and that can take different degrees. So can you explain a bit more about the stress, and that everybody is actually is concerned about that? It affects everybody.
Absolutely. I mean, there's copious medical research showing that mental stress causes disease. We know it causes cardiovascular disease. There are all kinds of illnesses that it creates. And we also know there's research that has shown that adverse childhood events cause disease later in life. There's a Kaiser study in the late 90s proved that adverse childhood events cause the leading causes of death in our society. And the more adverse childhood events you have, the more likely you are to have disease. And this was statistically significant, highly correlated. Oof. So we know that stress is stored in the body, that we can't process major stress, and we know that it later causes illness. So that's the foundation that we're working from. In my view of the world, stress, anytime that we cannot handle stress, anytime that the stress is bigger than our ability to cope, we run the risk of storing it in the body. Okay.
Oh, say that again. Say that again. It's too beautiful.
Anytime stress is bigger than our ability to cope with it. Okay. We don't have the skills to handle it. It's too big. Anytime that happens, we run the risk of storing it in our body. And this is why we have disease. Now, it might be that you didn't have the support you needed. You might not have had the skills you needed. It might have just been too much to blow your circuits. And so it's actually a protection mechanism to store it in the body, because otherwise it would damage our psyche. It would really leave us damaged. So we're very grateful for this protection mechanism, but we need to unwind and unload this stored stress if we don't want to end up with chronic illness later in our life. And so stress is super important in my work. And then, we also have ongoing stress, which I think is more what you were referencing. When our nervous system is in fight or flight, which is what happens when we're stressed, whether it's a big thing or a little thing, like our body doesn't know the difference in a really tight deadline at work and frustration with our boss versus we're in immediate mortal danger. Like it doesn't know the difference. So when we are under stress, it activates our nervous system, puts us into a fight or flight state. We're consuming resources and we're not healing anything in that state. And so once we return to normal, most of us don't have time to recuperate. Nature has time to recuperate. Nature will take time to let the body recover from that stress, but we don't do that. We keep going and going and going. And so we never get back into that parasympathetic healing mode where our body can actually start to rejuvenate and repair, or we might be there way less than we need to recover from those stresses. And so that's really, in my opinion, the crux of the problem, is that we never get into rest and digest, which is what we need to be doing to digest our food, to repair tissues in the body, to lower our cortisol levels and adrenaline levels, to get back to a healthy baseline.
Wow. And I think you mentioned to me also that when we don't, I'm sorry, when we don't have this capability anymore, when the body doesn't have the capability anymore to recover, it's like it loses the capability. It's like it forgets how to do it. And that's, yeah. I've read somewhere also that stress is, of course, because of the environment, but it's also linked to how we view the situation, how we interact with it. And that's also your type of work you do, also helping people in that sense. Yeah, I remember a long time ago, I interviewed someone about neuroplasticity, and it touches the resilience aspect and forcing you to really listen. And that's something I would like you to give us a little example about the importance of what does it mean. And by the way, there are two sentences, very simple, I took from your programs. But this is the thing. people have to understand, I'm taking the teacher perspective, but people have to understand that simplicity is powerful. Okay,
Absolutely.
we've read enough, we've done master classes. Okay, now what? So you said things that sentences are very simple, but for me, they hit the point, which is, what if your body could tell you exactly what's wrong and how to heal it? You know, just listen. As you say, take a moment to understand you're not split, you are one. So listen, be intuitive in that sense about yourself. People know more about the mechanics of a car or of a computer than about their own biology. We have some issues here.
Yeah, we do.
Yeah.
Yeah, I like to think of stress. I call it a stress bucket. We all have a capacity for stress, and we have a bucket. And when a stress comes along, if our bucket isn't full, we have room for it. And the stress can come in and it fills a little bit of our bucket, and that's fine. We have resilience, we can handle it, and over time it'll ebb away, right? If, on the other hand, we're maxed out and our stress bucket is already full and another stress comes in, it causes an overflow, it causes a spill.
Right.
And that's when we get reactive, we lose our temper, we get a health problem, we end up exhausted with burnout when that stress bucket gets too full and stays full. And so, if we hope to be resilient and to be able to handle stress as it comes along, we need to work to keep that stress bucket a little bit lower. We need to lower it. And all kinds of factors can help that happen. We can do self-care, we can take time to recover, rejuvenate, we can make sure we get enough sleep. We can eat foods that are nourishing and healthy for us rather than things that cause stress in the body. So all kinds of different stresses play a role in that bucket. But if we have that resilience, then we can handle what comes along without physical impact and mental impact. So I really like to think of it that way because it's like a bank. It's like a bank account, really. The more, except an inverse bank account, right? It's good to have it lower. But we have to make an effort to decrease stress because our common society is surrounding us with stress at every opportunity. And so we really have to make conscious choices. Instead of staying out late with your friends, you go home and get enough sleep. Or instead of grabbing a quick bite to eat that's fast food, you spend a little extra effort trying to find something that's healthier. These things require planning, they require choices. But if we do, it lowers our overall stress and really sets us up for more resilience.
I'm going to ask you if you want to give us an example of what people can do. I mean, you just give some examples of making a choice, because I think it's still not easy for people. We are so brained washed on a certain way of doing things, with quick. And as you said earlier, when you are in a stressful situation or panic situation, as we know, your mind narrows down. It's like the reality shrinks, and you can't see the big picture anymore. You're in a panic mode, survival mode in that sense. So you need to be into, I like this expression, being. You need to take a step back and be with yourself to be able to reopen your mind and see the big picture. So I'm sure you have your own routine, but can you give us an example of, without going through a program, no, but just give us an example of what people could do on a daily basis?
Yeah, I think that it's actually the basis of my healing technique. One of the most valuable things you can do when you feel off balance is take a minute and actually notice what's happening in your body. And I know that sounds really basic, but let's say you're really afraid that you're not going to get you're going to be laid off. Your company's doing layoffs and you're super afraid that you might lose your job. So my advice is to just take a minute and tune into your body and say, where do I feel that? Do I feel something in my body? Okay, I feel that in my chest. I'm really afraid. I feel a tightness in my chest. Beautiful. hold that a minute. Give it some face time. Let it be seen and acknowledged. Feel the tightness, feel the fear. And typically this process takes less than 30 seconds. This is not a long affair. Just connecting to the emotion that you're feeling and any body sensation connected to it and giving it permission to move is a very, very powerful thing. Acknowledging that it's there and then saying, okay, I understand I'm afraid. I feel the fear. And now I'm open to you leaving fear as soon as you're ready to leave. Very simple process, but incredibly powerful, because what it starts to do is actually shift the energy out of it. Because I believe any triggering in the present moment has some kind of anchor in the past, or we wouldn't be experiencing it. And so it's allowing that origin to start to unravel. So this is a
Beautifully
very
said.
simple process. Yeah, very simple process.
I like the link you made with something that you might have experienced. And you know, this is interesting because I assume, I don't know, but I have a friend who is a psychologist, and it's like at some point, we don't need to know what happened to you when you were two. You know, there is an energy blockage, let's remove it. You know, so we have moved so much beyond the Cartesian way of looking at things, putting things in boxes, and it doesn't work that way. And also what I like about your approach is that you made it simple, and it's powerful in that sense, simple. And this is actually the future. This is the future of medicine. It's like you mentioned the concept last time of ownership. This is so important. I don't know if you want to elaborate on ownership. People have to take responsibility for their health. What I'm saying that way, but you know.
Yeah, I really believe that the future is going to be a beautiful integrated. I mean, I think we're going there. It's just taking time. But it takes 20 years in the United States. Research has shown it takes 20 years from the time of a discovery until the time it ends up in clinical practice. That is 20 years you could be using that information to heal yourself. And you may not have 20 years if you
Exactly.
have a disease that could respond if you knew what to do, but you don't know what to do. So I feel it's very important for us to take charge of our health. And if we, obviously these things have been proven to help health outcomes, there's no question. And if your doctor is not suggesting it, then you need to take responsibility and say, what can I do to help myself so that I can feel better, so that I can be healthy when I'm 90? Not
Exactly.
just surviving, but
Exactly.
thriving. And that's why, yes, I feel very strongly we need to take ownership of our health to incorporate some of these very simple yet incredibly powerful changes that we can make. And honestly, what you eat, how you sleep, and working with energy that comes up in your experience, I believe are really three of the most powerful things we can do to optimize our health.
Yeah. No,
Yeah.
that's very, yeah. The other sentence you put in one of your program, you've done the diets, you take supplements, the protocol, yet something still feels off. And that is also a trigger point, as you say, a sign that, okay, there's something deeper than I thought. Okay. And I really have to address it. So my point is, sometimes I do the same. Okay. I don't put myself away from, I'm just like a regular person too. But to focus on listening, being in touch with your body,
Yes.
this is so essential. So in that sense, own your own health, be active, in that sense.
And Vivian, people think, they ask me all the time. It's actually one of the most common questions I get asked. Were you born with these gifts? Were you born
Yes.
with intuitive gifts? And my
Yeah.
answer is always absolutely not. Like I come from a medical family. I have 2 engineering degrees. I had no intuitive skills until my own health crash when I had to start developing them to figure out what my body needed. So I'm really, really passionate about teaching people that anyone can do this. Anyone can learn to tune into their body and learn to feel what it needs and get that information and then be able to take action that is aligned with your body's needs. And so
That's
I do believe it is the cornerstone. And if you are unwell, it is harder to get clarity. It is.
yeah.
And so it's really important that you start learning this so that you can start practicing and start tuning in and asking. And if you want to play with this at home, listeners, all you need to do is right before you go to bed or right after you wake up, just before your mind is busy, just ask your body, "Hey body, is there anything you want me to know today?" And just
Mm,
open to listen and see what you might pick up. You never know what might show up for you.
that's very interesting. I like that. Yeah, yeah, absolutely. Yeah, yep. Thank you for that. Yep.
Yeah.
And that brings us to the question of education, to educate people. And of course, maybe not nowadays, but in the long future, far away, maybe it's going to be practiced. It will be something taught even for toddler or whatever. But for now, like in Tibet, you see kids of 3, 4 years old meditating. But yeah, so your approach is, of course, to help people, but it's also through education. You have this access to education, and that's the thing. And people have to understand that once you shift your mind in that sense, thinking maintenance of my body, actually also it's not about I have a headache, I take a pill, a Tylenol or whatever. It's about transformation. Health is not just to feel better, is to transform yourself. The body and your mind, anyway, the two are always changing in time. So you really have to think of your health in terms of transforming for the better version. I'm so sorry, to the better version of you, for in that sense. So education, learn and transform.
Yeah,
Yeah.
and they go hand in hand, right? So
Yeah,
as we transform, we're in tune more because we're more present. We're being in
exactly.
the moment. So even taking one little step, either one will start bringing you toward that coherence where you're at one with yourself and your health will improve at the same time. I just wanted to mention, I actually have seen several school settings where meditation and mindfulness is being practiced. It's not systemic. It's not everywhere, but
Okay.
there are some little spots where people are using these tools, and it's quite exciting, and it gives me
Cool.
hope for the future. I
Yeah.
mean, even after
Yeah.
school suspension, doing mindfulness practice, really pretty cool.
That's cool. Yeah, it
Yeah.
is. And yeah, and somehow we feel it. I
Mhm.
mean, of course, people like you are in the community where people think like you. But actually, when you go out of this and go in the regular things, traveling abroad, you see that, yeah, there is as they say, an awakening. People are slowly moving to that. So, yes, to be hopeful, I am actually, yeah, just like you said. Now, let's address women. Women in society. We have That's another topic. But in terms of health, in terms of that, women accumulate so much more than men. My view and discussing, talking with other professionals. And so have you noticed with your clients or friends or your milieu colleagues, or are there things that are really associated to women when it comes to that? Like in terms of their lifestyle, environment, the lack of support. Yeah, we know from a medical, there's a lack of support. And you mentioned something last time about hormonal things, adrenal and thyroid. And being, for women, this approach of being, I mean, for everybody, obviously, but for women, being, because our health is really, after menopause, is really not taken seriously by the the regular medical field. So what's your thoughts on that when it comes to women?
Yeah, I have so many thoughts. The first one, just of interest, is that I think the number is close to 90% of health decisions are made by women. Like it's an incredibly large number. So women, we women are really taking on the responsibility of how to care for ourselves and our families.
Mm,
We have that responsibility, really. We take it on, I guess. But
mm.
we also, as you said, there are tremendous inequities in research and knowledge of the female body. A lot of research is focused on males, and not so much is known about, especially in the conventional circles, about hormonal balance, about the changes that women go through, about how that impacts. Someone shared a statistic that if you are a woman having a heart attack and you go to an ER, you are twice as likely to survive if your doctor is a female versus a
Oh,
male. It was
and
really staggering.
the
So
reason is,
they present so differently. Heart attack presents so differently in women than men that
mm,
often men will discredit heart attack symptoms in women. Yeah, it's fascinating. Anyway, there are so many
mm,
inequities around this. And to me, what it means to me is we absolutely have to be our own advocate. We
exactly.
have to be educated and we have to advocate for ourselves. If we're in touch with our intuition, we know when something's not right.
Mm.
We know. We just know.
Yes,
Like,
it's
nope,
true.
this is different.
It's
This is
true.
not the way I normally feel. Something is not right. I
Mm.
need to figure out what this is. And we've seen time and time again, there are always reports of someone who had colon cancer because it was discredited because they were in their 30s. And
Ah,
finally, a month later, they were properly diagnosed because they kept fighting and kept saying, no, something's not right. And so we need to be in tune with our body. Well, the best way to do that is to start tuning into our body and being present with it.
mm. Yeah,
And
no,
then
exactly.
educating ourselves. Yeah, we really need to educate ourselves and have tools available that we can rely on when
Mm.
we need to ask ourselves things, when we need to clear anxiety, when we need to try and work through something and then determine, do I need more help or is this good? Like we need to have some kind of way of knowing that as
Mm.
a general practice so that when something big comes along, we know how to take action.
Yeah, that's well said. Yeah, yeah. There's I'm sure you have noticed there's more and more concern about you see that in summit for women or master classes about women, menopause. I love that because they say society is getting old. Yes, okay, we know, we see it. But that means also more women reach the category, the group of women from the 50s and up. We are more than the young girls, so this topic becomes very, very important because it's quite a shift, which made me think, I think I mentioned that to you last time and we smiled about that. But the thing is, it occurred to me that the moment you have your period as a young girl and you reach menopause, let's say, you, I say suffer is not the right term. Let's say you're not comfortable. Let's put it that way. Although I know some women suffer during their period. But imagine average a week of period per month for so many years. If we count it in that sense, 1 week per month, that's 12 weeks a year. That means 3 months per year.
Mhm.
You are in a suffering mode. Let's put it that way.
Yeah.
So, what do you do with that energy? What do you do with those 3 months? So, that made me think that's a lot of time that we waste. So, this approach, and I'm saying that with a conviction that if women are taught early enough how to take care of their body,
Mhm.
those 3 months will not per year will be reduced considerably. So that's part also what women should think about seriously. Don't push it and say, well, that's women's body. You know, how many times we've heard that, oh, cramps is normal. No, it's not normal. You know, so in that sense, it's like we have to take responsibility for our. There's something that you do that I love. I think it's in your newsletters, or anyway, I get them, but 5 or 6 minutes of video you do. So if you can say a few words about that, it's very interesting because it makes you stop and, take time to think about it. Yeah.
Yeah, that would be my monthly mini. It's really kind
Yeah,
of fun.
exactly.
Every month, I take 5 minutes to balance something, introduce an idea, balance something in the, whatever, in your energy. And it's a wonderful way to, yeah, pay attention and consider something new that might be impactful for you. Um, it's also relevant. It's tailored to what I'm seeing in my own practice coming up for people. So usually it's a timely thing. It's designed to be timely,
Okay.
but also to introduce some new points of view. And yeah, it's a lovely way just to check in.
Cool. Great. Great. Yeah. So we are getting close to the end. A simple question, but just for me, curious. What are the most important blockages you see in women in your field? The common thing you see over and over
Mhm.
again.
Yeah. One of them would definitely be a difficulty putting our needs first.
Ah,
I find this is absolutely at
oh,
play with breast cancer.
mm,
It's absolutely at play with burnout, chronic fatigue syndrome, fibromyalgia, uh,
oh,
low fatigue, low focus, low anything. Depletion is
oh,
really burnout.
oh,
And it's because we feel this compulsion to put everybody's needs before our own. And there's always something to do before our needs. And so our needs never get met. So this is a real dysfunction in our society. And it must be healed in chronic illness. It must, in order for someone to find healing.
that's beautifully
Uh,
said.
yeah, it's probably
Yeah,
the number one.
okay.
And I think a second one is you referenced it just a little bit ago, which is a disharmony with our femininity. And there are so many different avenues this can take for different people. For instance, my mother was an attorney at a time where women weren't allowed to be
Mm,
attorneys.
mm-hmm.
And she was told that she was a woman and she'd never be able to be an attorney, and by her college advisor, actually.
Wow.
And she's like, that just made her angry. She's like, well, I'm going to show
Yeah.
you, which is fine. But there becomes this battle with femininity. It's a liability, it's a weakness, it's something that gets targeted by others. And so there are different ways that that can manifest for different people, but the result can be menstrual dysfunction, hormonal imbalance, difficulty with feminine power. Feminine power, we haven't really talked about that, but we women have the ability to be more intuitive, more sensitive, more intuitive with the world around us, including the men in our lives, the boardrooms in our lives. We have an advantage when it comes to being able to perceive and intuit and create a plan of action based
Mm,
on that. And that's feminine power. And
exactly.
so this
Mm-hmm.
whole femininity piece can be a big disruption for folks as well, usually based on
Mm.
past relationships, past family experiences, and such.
Cool. That's very interesting. So, people, you hear 2 points. Women. And this is so true, actually. Many other coaches have addressed this issue. Even in coaching, women coach have this kind of hesitation that comes from that. So, difficulty to put ourselves first, to take care of ourselves. And how do we relate to our own femininity, our own inner power? And that leads to leadership. we have to get back to our own leadership. I'm not talking about being a head of a country, I'm talking about your own health and life, actually. Wow. Cool. Thank you. Thank you. So we reached the end. So thank you so much, Sarah, for your time with us and sharing your perspective and wisdom on the importance of being at the foundation of health. I hope that our discussion inspires viewers to explore more on the subject and be on the transformative path for their own health. Anything you want to add before we close?
I will just add that you have the power to completely change your health, and don't let anyone else convince you otherwise.
Oh, that's so beautiful. That's so beautiful. And take it for someone who knows. Okay. That's wonderful. Yeah. So people can reach you and follow you on your website listed in your bio under the below this episode, and on Facebook, also Instagram. And so thank you all for being with us today, and until next time, have a clear and conscious journey. Namaste. Thank you for joining us today for Women of the Wise Path. Continue the journey with more conversation, events, and resources at the address below. We'd love to hear from you and what you would like to talk about. Together, we're shaping a future rooted in wisdom, collaboration, and the infinite power of the feminine spirit. Until next time, may we walk all together the wise path, guided from within.